Welcome back. It's time now for our In Focus Health Update, and health reporter Linord Moudou is here to tell us about an innovative procedure to help people living with HIV who have failing kidneys. Hi, Linord.
Hello, Dimiake. Well, we start in South Africa, where a doctor has pioneered a technique to transplant kidneys between HIV-positive donors and recipients. Her procedures are highlighted in the prestigious New England Journal of Medicine, earning her global acclaim for her innovation.
Okay, you can give me a bulldog.
This is Dr. Elmi Muller. In 2008, she became, along with her team in Cape Town, the first physician in the world to transplant a kidney from an HIV-positive donor to an HIV-positive patient. Since then, she has performed 14 surgical procedures at the world-renowned Groote Schuur Hospital. The facility gained international recognition in 1967 when Dr. Christian Bernard performed the first successful human heart transplant. Dr. Muller says kidney failure is prevalent among HIV-positive people because the kidney is adversely affected both by the virus and prolonged use of medication to keep the virus under control. HIV-positive patients with end-stage kidney failure have never qualified for dialysis or transplants in the South African state sector.
In South Africa, when I started the program for HIV-positive patients, the patients didn't actually qualify for dialysis in the state sector at all. The patients were sent home to die. They didn't have the option of dialysis, they couldn't get a transplant, and we offered them no treatment.
Dr. Muller realized that the kidneys of donors whose blood samples showed they were HIV positive were not being used for transplants. So she decided to investigate the option of transplanting these kidneys into the bodies of other HIV positive patients.
And the reason why we can do it is that we have such low resistance rates in South Africa of HIV resistance. So it's a fairly safe thing in the South African context. We got antiretroviral therapy quite late, and that means everybody started on triple therapy straight away. If you look at resistance patterns, it develops mostly when you start one ARV and not a second one, or you don't start the triple therapy straight away. So in South Africa, we started all our patients on triple therapy, which means we don't have that high rejection rates.
In 2002, Nomakaya Plaje was diagnosed with HIV, and 5 years later she discovered she had kidney failure and needed a transplant. It has been 2 years since her transplant surgery.
I would like to encourage organ donors to come forward because there are a lot of people that are very sick and need them. This will give them a chance to a new life. People should donate their organs with an open heart because they are not only helping the doctor, but also giving someone a chance to raise their children.
Dr. Muller says a lot of support is given to the patients after surgery. One patient, Bulelwa Nkusani, is HIV positive and has received a kidney transplant.
The kidney transplant has made a big difference in my life. I couldn't do anything myself, but now I can do whatever I like.
The donors don't have to be HIV positive, but Dr. Muller says the waiting period for the HIV positive donors and kidney transplants is shorter. Most of the kidneys come from HIV positive patients who are brain dead or people who have suffered from trauma and whose families have consented to the procedure. Dr. Muller has an active interest in promoting organ donation and transplantation. She is currently the International Transplantation Society's counselor for the Middle East and Africa region, as well as the president of the Southern African Transplantation Society. And for AIDS patients, stigma and discrimination has greatly increased the negativity associated with the disease. UNAIDS says the HIV/AIDS stigma continues to create major barriers in preventing further infection, alleviating impact, and providing adequate care, support, and treatment for patients. Some analysts say while increases in HIV/AIDS services is expensive, the impact of AIDS stigma is just as costly. HIV-related discrimination continues to manifest in virtually every country, including Ghana. Faustina Okenchi's restaurant, Tina Special Meals, was very popular a few months ago, but when word spread that she had HIV, she lost nearly all of her customers, and today she's looking for work.
I used to do stigma reduction program in the town outside my area, but I don't know whether somebody may know me and will come and publish me or whatever. Looking at humans' knowledge, especially Ghanaians' knowledge concerning HIV, it means that if you are HIV positive and you are selling food, you end up infecting the people.
For you to get a job in Ghana, they ask you to do HIV tests. Do HIV tests, even force soldier, police, immigration, custom, they ask, it's compulsory.